This video will go over I like to call it the twin brother of the method section, the results section. So methods and results are often almost referred to as one section, but there are different sections. Although they have a lot of commonalities. Again, you'll remember in that hourglass shape that we are, sorry about that, that was a terrible drawing. Let me do that again. In the hourglass shape of the IMRED article, we're right here in the middle of the very specific information. So the results section is right there with the method section. So let's look at some general rhetorical moves, some guidelines, some major dominant elements that effective results sections should include and tend to include most of the time in scientific articles. I do want to give some tips also on writing them first, and I think that the results section, before you when you start writing it, before you do that, actually think about preparing your tables and figures first, because they will determine what actually goes into your results section. Because sometimes you cannot express everything in your results section. Similar to when you think back in the method section, the flow diagram, you can't possibly write all that out in sentences. You'll never finish your article. So preparing your tables and figures first is a good idea. You might not use all of them, you might have to revise them, but at least it's a good start. Once you've done that, I always recommend to writers to step back and ask yourself, what's the big picture here? What are the major trends? What relationships are evident? Right? Because those are all things that you want to explain, you want to include in your results section, and ultimately in the discussion section. You want to summarize what the data show, and this is very important both in your writing and reviewing results sections. Really make sure that in the results section you only summarize what the data show rather than start analyzing and interpreting it. There is some controversy around this. If you read the module description for this week, you've seen me write about this, especially referring back to a wonderful little book called How to Write a Scientific Paper by, hoping I'm pronouncing his name correct, Jari Saramäki. I think he's from Finland. Yes, he's at the Aalto University in Finland. He's a computer scientist. And he actually really decries the fact that we separate discussion from results. And be that as it may, in a lot of biomedical fields, that is still the MO. That might change, I don't know. For right now, we're treating the results and discussion section as separate entities. So summarize the data show is the major, focus. And if you remember, if you read Ainsley's article on the results section before watching this video, if not, you will read it in his article. He distinguishes between not just talking about data, presenting data, but also the results. And there's a finite difference between that. He gives some really great examples. I thought about including them in the PowerPoint, but I have other material to cover. So make sure you pay attention to that in Ainsley's text. I thought that was really insightful. You also don't want to just repeat the numbers that are already in the tables and figures. So especially in the results section, when you're using tables and figures, it's another balance that you have to do between what you include and highlight in the text and versus what you leave in the table for your readers to look at, and you guide them towards it. So let the readers themselves go to tables, figures for more details. If you have the tables and figures there, don't write about them in your text. Do want to mention reporting guidelines, because they can be useful both when you're writing as well as when you're reviewing an article, the methods and results sections for an article. Guidelines differ based on study type and to a certain extent discipline. And Ainsley again has a little table in there with some really good lists, and I'm going to show you one in a second. Guidelines serve as checklists for researchers. Some even come in checklist format. It's very nice for those folks to do that. And editors and reviewers use these checklists when evaluating manuscripts. So following them as you're drafting and you're writing your own, or as in case you're reviewing. Again, little hint for those of you when you're comparing for this week's assignments, those two results sections. Pay attention to that. Use those to your advantage as well. So this is the example I want to show you just for us to look at together. This is from the Consolidated Standards of Reporting Trials, called CONSORT, very widely used checklist. RCT, randomized control trials. You might not come across that acronym a lot. I think I've explained this before in this class. So let me click on this with you. This is what the website looks like, all sorts of different things. And the two documents I want to show you right here are these two. So I'm going to click on them. Here is the checklist of information to include when reporting a randomized trial. And so it tells you the title and abstract, introduction, background, and motives. We have looked at this, yay. Methods, trial design, and so on. Results, discussion, and you'll see many of the discussion, invitation, advisability, interpretation. Those are all things that we'll cover in the next module discussion. But especially for methods and results, I think this is really useful to look at, okay, all of these, have I covered all of these? If my discipline follows these particular reporting guidelines, or these guidelines, or if you're reviewing, are these all present, right? It can be a great roadmap. The other one I want to take a look at with you is the flow diagram based on this information. And you see, there we go. It looks a little weird just because the way it pulls up here in Word on the iPad that I'm recording this on. So it looks a lot better when you actually look at it as a Word document. And I did include those as Word documents, as handouts for you. So hopefully you had a chance to look at them before. So this shouldn't be new information. But this is the similar information, the checklist and the flow diagram that can again help you either putting together your material and or reviewing it for somebody else as well. So let's continue. To outline the results section, there are a couple of different ways to do that, and I'm borrowing here from Ainsley's, hoping I'm pronouncing his name right, Ainsley's text. And one is in chronological order. Another one is to group your results by topic or experiment. You can start with general to specific, or most to last important, or a combination of these, right? I mean, that's what some authors do as well. But those are things, some basic guidelines. I doubt that you'll find too much out of these 4 different ways to outline the structure of your results section. If you do, please let me know, because I'd love to include that in my revision of this video for the next cohort. But I have not, I was looking at this, and I don't think in my, sort of going back in my brain memory, I have not seen any other way that authors have presented their results. So this is something to, as you're reviewing it, pay attention to. Do you feel this is done in a chronological order, general to specific, and so on? Always a great way to get deeper insight into an article that you're reading. So here's some general tips in structuring the results section. So I always suggest to highlight differences between results and percentages in text, if given in absolute numbers. Sorry, there's an N missing here. If given in absolute numbers in tables, or describing numerical values such as twice as large. This is just for readability. Break into smaller parts. Use subheadings if needed. I'm not sure why this showed up differently, but you get the point. Subheadings, again, great to use in the results section as well. Nothing wrong with that. I think it's okay to repeat and highlight, but you only want to do with the most important numbers. So if you repeat too much or highlight too much that is not that relevant, your readers might question very quickly, like, why is this being highlighted and repeated? You do want to include negative and control results, and I think I see this a lot in review comments, in viewers' comments, when authors have forgotten to do that. Not out of ill will, but because they didn't think it was important, or just fell to the side. That's a really important piece. Make sure you include that if you have negative control results in a study, which you most likely will have. And this is a kind of pet peeve of mine as well. I love that. I've been reading over the years, a lot of different guidebooks for scientific writing and journal articles and so on. This comes up in almost all of them. Don't overuse or misuse significant. When you say significant, it needs to refer to statistically significant. That's the way we use significant, particularly in the results section. So cut the word significant out of your vocabulary, apart from using it for statistically significant results that you're reporting. Anything related to why you did something belongs in the method section. Okay, so if you start explaining here why you use this particular method to get this result, copy paste, throw it in the method section, and then see if you can integrate it there. I see this sometimes in the results section, and that's really not appropriate and not necessary, and takes away your reader's attention. And very important, do not include comments on the meaning of the results here. It goes into the discussion section. What does data show versus what does data mean? And applies to most research in biomedical journals. I mentioned earlier, Jari Salamäki, a Finnish colleague who wrote a book, How to Write a Scientific Paper, sees this a little differently. And there are some journals where the results and discussion section are combined and you just have a small conclusion at the end, like maybe a paragraph or two. So that exists. However, more frequently you'll see them separated and you will ask to produce them in a separate way. And if you don't do it, reviewers might have a reaction to that, and that is usually the positive reaction. So some examples I want to show you is typically done in a results section is to summarize information from tables. And by summarizing, I mean summarizing, do not repeat the whole table. So here, for example, and you'll see this more clearly on the handout that I've given you. It's hard to see the exact table here on the screen, but it's a big table, lots of information, right? And this is all the authors provide for the reader. Table 1 presents a profile comparison between 3 groups who completed the study and includes those in both the control and intervention arms of the study. Primary brain cancer, brain metastases, and all other cancers, not including the first 2 groups. So right up here, primary brain cancer, brain, and then all other cancers that don't belong here. This is again from the study by PLSL1. I don't think I've used this one before. But I like the table. It's very detailed. But they don't explain all of these information. This is what we did, this, and so on, all the different characteristics. No. You want to know what the employment status was of people in the brain metastases versus in all other cancers groups, you can look it up yourself. Right? Important information, but no need to put that in writing within the text. You can use the table and summarize the info and refer your reader to the table. Another example here, this comes from our drug safety study that we are using over and over again. Table 2 shows group differences in the numbers of patients with cardiovascular events and mean time to the occurrence of each event. The 3 most frequent cardiovascular events were angina pectoris, CHF, and MI. So you see right here, up here you have all the different drugs that they're testing. Here are the different cardiovascular events. Are they writing about all of these? No. They're just saying the 3 most frequent cardiovascular events were these 3. Okay, so angina, MI, where is it? There it is, and CHF, there we go. So just so it doesn't say for all the different drugs, they just summarize briefly what's in this table. That's it. So think about that when you're either writing your methods, your results section, or if you're reviewing it, either for this assignment or in general as well. And as if when you're consuming it as well as consumers for your own work. There's something on active voice. I'm a big fan of that. And the same thing that applies to the method section applies to the results section as well. It's nice to use active voice as much as possible. So let's look at this here. We plotted the adjusted survival curves in 3 graph figure. Great. Present active voice. The first graph shows also active. The second graph is also active. And the third is also nice structured sentence with first, second, and third. Survival curves indicate. The survival curves without a history of paralysis shows. Unlike previous graphs, they dropped. The risk increased. The graph showing suggests that no passive voice whatsoever. It's probably a little easier to use more active voice in results than methods. But I still see a lot of passive voice in results sometimes, and it's not necessary. There's an active way to describe it. And you might notice there is a switch between past tense here as well. Again, we plotted, reminded you what they've plotted these. But then when they're describing what actually is being plotted and what these curves show or what these figures show, they're using the present tense. Another example, this comes from the study that we've also looked at a few times from the ethics from the Journal of Academic Ethics on the research misconduct in the Middle East. We obtained surveys, present tense, were from, present tense, shows, present tense, arranged, more than a third represented, majority was right before, more than were female, see I'm even missing some of the verbs here. They had either earned, so lots of detail here. Those who obtained a degree, they received this. More than half indicated. For question related, we analyzed. For questions regarding, we analyzed. Also, not a whiff of passive voice in here, at least not from what I can quickly see here. It's obviously the reason why I selected it. So you can use active voice a lot and almost exclusively, or almost exclusively, in your results section, and I really would want to push you for that. If you see this in some of the articles that you might be reviewing for this assignment, that would be something to point out, right? Because there is a way to actually be more active in the results section.